All right, let's bring in our guest, Dr. Jide Idris. He is the Director General, Nigeria Center for Disease Control and Prevention. Dr. Idris, thank you so much for joining us on Weekend File.
My pleasure.
All right, reports we're hearing 40 confirmed cases for Nigeria out of more than 800 suspected cases. Tell us, what exactly is Nigeria contending with?
The figure seems to have changed in the last 24 hours. We now have 43 cases. 33 cases came from Osun State, Enugu, and I think Abuja State. So we have 43 cases in the country right now, out of about 834 suspected cases. Now, basically, when the public health emergency of international concern was the WHO and African CDC, we here in Nigeria too activated our emergency operations center. We've appointed our incident manager, and we quickly carried out a risk assessment, dynamic risk assessment on MPOX, using the MPOX technical working group. And basically, they rated the risk level they gave was high risk. But again, our activity should be targeted at those states where we are recording cases. Like I did say, we have 43 cases confirmed from about 20 states. But the interest is that most of those states very close to the Cameroonian border, especially in the south, and southeast, the states recorded the highest number out of the 43 cases. And secondly, we have got in touch. We had a session with the sub-national levels. We met with the commissioners of health in various states to ask them also to activate their emergency preparedness and response strategies in those states and come up with their response plans. Some of them have started doing that because from reports we've gathered here, at least Osun State, Rivers State are doing very well, and I think Enugu State. But we've sent out advices to them, telling them what to do. We're also supporting them with some information they require in terms of training, in terms of the major area now has to be diagnosis. We're lucky in the sense that all the 43 cases we have in the country are from the Grade 2B type, which is the less serious ones. And we have recorded no for now, luckily.
But very curious, Dr. Idris, is it treatable?
Well, luckily, it's treatable because the only how it presents is that it presents with the basic symptoms of fever, body aches. Then you start having the rashes that move from accumulation of fluids and then become pus. And it takes some time to dry up. They are infectious, where those secretions are infectious until those skins are dried up. And the easiest way is to get them cleaned. Most times you use calamine lotion, just like you do for skin rashes for smallpox and the calamine lotions. You monitor fever. People who have fever, you give them anti-analgesics to reduce the fever. But the main thing is that you have to be careful for superimposed bacterial infections. And that's why, again, you need to stockpile just in case they get secondly infected. That's probably what kills. Most times, this does not kill, but it disfigures people. And that's why, again, most people don't like coming out because of stigma. And, so one thing we're advising that people should not stigmatize these patients. But in terms of diagnosis, we will realize that very few laboratories in the country can actually diagnose MPOX. There are very few. What we're trying to do is get in more laboratories and spread across the country, especially those areas where we are recording cases. Right now, all the cases detected were confirmed from 2 laboratories in Abuja here and Lagos. We've also now added these other labs as part of the network for MPOX. There is the lab in Naima, the lab in Luth, and the lab in SGIT in Oshobo there. We are looking at scaling up the two laboratories in the south-south, perhaps the University of Port Harcourt and Enugu.
Okay.
They have laboratories that can actually diagnose it. All they need is reagents and which we are going to supply to them and consumables, and then train their staff so that they're able to detect this thing.
Okay, Dr. Idris,
Yeah.
it's good you're breaking, efforts being put in place.
Yeah.
But also, it's also necessary, luckily for Nigeria, but unfortunately, because of what we're dealing with, it's grade 2 strain we're talking about, which is not so severe. So there is need for a coordinated, multi-sectoral approach,
Yep.
especially in the aspect of surveillance. Now, looking at Lagos, as a case study, if we look back to COVID-19 era, we saw how cases, were always more rampant there in Lagos. So what measures are in place in terms of surveillance from your reports?
Like we did say, all the states have been asked to establish their preparedness and response plan, set up their teams to start carrying out, to do, and this response involves surveillance. This time is enhanced surveillance. It involves public awareness systems. They will say, intimating people of how MPOX, what causes MPOX, how it presents, and how it can be prevented. They should ramp up their diagnostic capabilities and increase suspicion amongst the healthcare workers. So in their laboratories, if they see people, talk to the health workers again, if they see people who are presenting with these symptoms, they should refer them to the nearest health facility where some of these samples can be taken. And once the samples are taken, they should be sent to the specific laboratories. Luckily, Lagos has about 3 laboratories there. So I think we'll get in touch with them again so that they can improve on their surveillance activities. But detection is more important because now they need to be able to detect. Lagos, I don't say Lagos doesn't have any problem because they have 3 laboratories. My worry is in the south, and southeast, and that's why we said we needed to boost some of those laboratories in that area. And again, so that at least when they send samples, they don't have to carry samples across long distances. We'll just reduce the turnaround time for these samples. More important, again, is the public awareness. Yeah. Most states are already doing that because we sent out advisories. They've sent out copies to them on leaflets, jingles, radio jingles, and even pamphlets so that they can actually domesticate in their various states, in their various languages again for them to hear. I know that in a number of states, they are going around from community to community. They're doing community-based surveillance, and they're using the community people again. So this is going, perhaps again, we need to ramp up again. And that's why again, we'll soon again meet with the state's commissioners again to advise them. We're sending out response teams from Abuja here to those key states to support them in whatever. More importantly, again, remember the port services have sent out advisories. They've sensitized the airlines again that introduced the declaration forms for people coming in from airlines, especially from those areas where MPOX have been ravaging, especially the Central African Republic, Kenya area, Uganda, even Cameroon. Okay. The interesting about Cameroon, cases they've seen in Cameroon involve both clades 1 and clades 2. And that's why we have to be careful, especially in the south-south where transmission, cross-border transmission is very likely. Okay, Dr. Idris, we'll pick up with that. It's very important, especially with the porous nature of some of those entry points. Yeah. Let's take a break. We're back shortly. Stay tuned. All right, Dr. Idris, we've seen the report from Enugu. Of course, they're putting their acts in order to contain the spread of the deadly virus. But in terms of intensifying coordination, if this virus must be contained, talking about its spread, international coordination is also required. What kind of support is Nigeria getting from the international community? Well, we're in touch with the African CDC for the continental coordination. We take part in their weekly seminars, events where they share their data from different countries. Also, at the sub-regional level, at the West African Health Organizations, again, we're also involved in that. Then in Nigeria here, we are collaborating with various, most of our partners, WHO, UNICEF, US CDC, Breakthrough Africa, so many of them, because they're supporting different aspects of our action plans. So, and again, we in Nigeria too now, we are coordinating at the national level, and that's why I said earlier that I've met with the state governments. I told you that we met with them last week. We told them what to do with respect to what they should establish. They submit their plans, set up their facilities, infrastructure, their staff, their diagnostic capabilities, and just set up the processes. I know that I visited one or two of them. Again, I'm very much impressed with what I saw. And I know River State is doing well. You heard what the Enugu commissioner said. They are trying to, because they were at the meeting we had with them. And we will intensify other efforts again. And we're sending out some other materials to them to assist them in what they need to do.
What about vaccine? We hear there is vaccine when the case when it's highly severe. Does Nigeria have enough, especially for those key areas?
Well, generally, Nigeria doesn't have enough. We don't have the vaccine for now. From what information we received from NAFDAC and the Federal Ministry of Health, we're expecting about 10,000 doses from the U.S.
Okay. And
from what African CDC said, they too are expecting about 10 million doses, and they're likely to give us some. I think MPHCDA, that's the agency that actually deals with vaccines, has made requests and recommendations for that. But I would just say that whatever vaccines that come in will never be enough. So between MPHCDA and us, we're going to sit down again to work out the modalities for distribution. And it's going to be based on vulnerability and susceptibility. We probably target the high-risk groups, like people with HIV, people who are immunocompromised, and especially people who we feel might be suspect or they have risk, like hunters, especially the bushmeat sellers. We need to look at that. But again, there's this controversy. The vaccine that is being that we're expecting, they've only been approved for emergency use. And I know that people are very skeptical, and they started reacting to this. So it requires a lot of public enlightenment again, and how to, because just like you have in COVID, you have vaccine hesitancy. Okay. We had the same thing with cholera vaccines. But my take is that, you see, we don't know, even this vaccine, don't know how long will it last. So our best bet would be to concentrate on control measures, basic control measures.
Yeah, you're talking about its potency, right?
Yeah, with the potency. And again, they're still undergoing, they haven't finished they go through this process of approval process before they are finally released.
Okay. Yeah. Dr. Idris, of course, we can't get tired of talking about awareness, prevention, and control.
Yeah.
Of course, Nigeria is at its peak of vigilance, but very important, the health are vulnerable, to the spread of this infection because they come directly in contact with these patients. What is the provision for them in terms of their protection, sensitization, and also, as you wrap up, sensitization to Nigerians?
That's why, again, we said that part of the advisory we sent to the states has to do with health workers too. Health workers must increase their level of suspicion when they see cases. And as they're coming in contact with these cases, they have to invoke these infection prevention and control measures. They need to protect themselves. That's one. That's why before they touch any of these patients again, they must have the proper PPEs. They use gowns, they use their masks, they use their gloves, and again they change this as they move from one patient to the other. So that they need to protect themselves first again. That's what we're saying. And I believe again, when the vaccines come, it may be one of the prioritized priority persons. But more importantly, again, is that whenever they're touching this case, any materials that were used for a case should be disinfected or disposed of and use a different thing. So the workers themselves, it's part of the IPC training we're giving them again, and it's part of the advisory we sent to all the states. Because the advisory involves both healthcare workers and the people themselves, what they should do or what they shouldn't do.
What about for people?
For people, we know that MPOX, we know how MPOX is basically a disease of animals that get transmitted to human beings. But in this country right now, we have more of the human-to-human transmission. So when you see any patient, any people presenting with us this disease, these symptoms, especially those of them that have rashes, that don't know the source of the rashes, first of all, let them report to the nearest healthcare facilities. Try as much as possible to avoid with these people. If you are going to be contact, do not touch, or you have to protect yourself before you touch. And again, we know how this is. That is carried through rodents, squirrels, and monkeys. So if you know of it, if you see of any of these animals that appear ill, do not touch them. We have hunters, people who go to this wildlife to hunt these animals, especially bushmeat. If you want to eat bushmeat, ensure that these bushmeat are properly cooked. And again, anybody that's trading bushmeats, again, they need to be properly protected. And that's where the healthcare workers too, the public health officials need to visit this, including the officials of the Ministry of Agriculture. They need to look into this again, because we're actually working along with them again, under the One Health platform. So these are the things, again, anybody you see with these symptoms, with skin rashes, let them report to the nearest health facility. Try as much as possible to avoid contact with them.
All right.
Any secretions from their bodies.
Okay.
That way, at least you don't get infected.
Thank you very much, Dr. Jide Idris. We'll continue to monitor developments, and for us in NTA, we'll continue to raise the bar on awareness campaign. Thank you for the efforts being made. He is the DG, Nigeria Center for Disease Control and Prevention.
Thank you very much.
You're welcome.